Hi, I'm Art Caplan. I'm at the Division of Medical Ethics at the NYU School of Medicine. Should doctors have to undergo cognitive testing when they reach a certain age, say 65 or 70, maybe even 75, in order to continue to retain privileges to practice? I know it's a hot button issue. I know a lot of people think it's discriminatory to test, but I'm on the side that says testing ought to be done, if not as the final say about whether you can practice or not, then at least as a trigger to go further and examine whether a particular doctor, or for that matter a nurse, might have a problem, might not have the cognitive wherewithal to continue to do the work that they're being asked to do in a hospital, clinic, or private practice setting. A couple of years ago, I had a good friend who worked with me on my medical ethics course. He was an intensivist, and when I was working with him on designing our medical ethics course, I began to notice that he seemed to have a hard time remembering certain things that we had discussed. I began to notice that his vocabulary began to shrink, if you will. He seemed to me to have an issue. He's a good friend of mine. I worked with him for decades, and I had to ask myself, should I do something? Should I report my concerns to anybody? I thought about it and I felt I had to. Not that it was going to end his work on the clinical side as a physician, but I wanted someone to observe him, sort of give their opinion of what was going on, and he was getting older. He was at least 70 years old. Well, I did mention this to people on his service and some of his supervisors, and they monitored him, and ultimately they stepped in and said, we're going to pull away your clinical privileges, you're not going to lose your professorship, we're going to give you other duties, but you can't be out on the front lines in intensivist care. I felt good about that. I felt like it was appropriate to put patient safety first. When I was concerned about my good friend and his ability to carry out his clinical duties, I decided I had to make a report, let others know, but I did not tell him that I had done that. I didn't want to ruin our friendship. I didn't want him to become angry at me. I felt almost embarrassed that I was going to do this. At the same time, I wasn't controlling whether he could practice or not. I just asked others to see if they saw what I thought I saw. So I did not let him know. Later, I did tell him that I was probably the trigger to having him watched, to having him talked to ultimately having him moved out of the clinical situation. It was after he had been removed, and I did tell him I was concerned, and as a friend, I thought I'd better speak up because I didn't want him to wind up hurting anybody or practicing in a way that he would be ashamed of. And he said thank you. He wouldn't have said that, I think, initially, but once he was observed and once he realized that others were seeing problems, and by the way, he began to pick up cues at home from his wife and his kids, I think he understood that it was better that we moved him and got him to a place of work where he could carry out the duties and not jeopardize anybody's health. And that's what I feel about testing. We can argue about what age it might be, but screening, surveillance, using some of the tests that are out there, there's one called microcog, but there are other exams that people can use to assess brain function. Just as pilots get tested after a certain age to see whether they can function adequately, physicians, nurses, people who hold lives in their hands, it does seem to me there ought to be some sort of mandated testing. Again, not that you can't practice if you flunk it, but that is a sign or a signal that someone may need to supervise you or check on you or do other interventions to make sure that you're mentally able to keep going. Now look, I have met many doctors in their 80s who are doing great. Their memories are better than mine and they're cognitively sharp and they can do what they need to do. But I've also, as I said, in the case of my friend, met others who are starting to decline, showing some symptoms. And I think it would be good if we could screen and make sure that errors, problems, bad outcomes are not caused by failing to monitor adequately this critical workforce. So I say yes to certain types of screening. We can argue about who should do it, should the state do it, how often, what age, but let's go over the hump, if you will, of objections that say it's age discrimination. I'm not trying to get rid of older doctors, older nurses, or for that matter, older bioethicists. I'm just trying to make sure that they can still do the job when we know that there are a lot of cognitive decline issues associated with age. I'm Art Caplan at the Division of Medical Ethics at NYU. Thanks for watching.